Hello everyone, I'm Dr. V. I'm a dentist. In today's video, I'm going to talk about the different specialties in the dental field. So first, I want to just go over what it means to be a general dentist. So when someone is a general dentist, that means that they do everything. So they don't want to be tied down and just do one specific thing for their whole career. They like the variety. So they can do fillings, they can do crowns, they can do implants, they can do extractions. Anything you want, as long as they feel comfortable doing it and they're a licensed dentist, then they can do that procedure. When it comes to a point where there is a complex procedure or something that they don't feel comfortable doing, that's when it's their time to discern whether or not they should do it or whether they should refer to a specialist. So we're going to go into what those different specialties are, and what that role and that specialty entails. Okay, so the first specialty is going to be a periodontist, and this is pretty much the gum specialist. So when a patient has a gum disease like periodontitis, then they go to the gum specialist, the periodontist, and a lot of their procedures entail deep cleaning, so scaling and root planing. Sometimes that requires them to do a flap surgery, but that's not all that they can do. They can do implants and other things as well involving the gums and the bones, tissues, things like that. But that is their specialty, to focus on the gums and really help those patients that have gum diseases. They also do procedures called frenectomies. If a patient has recession around their teeth, meaning that their gums are moving away from their teeth, they can do procedures where they kind of cover up those areas that are lacking the tissues to cover the teeth, to put new tissues over them and kind of cover that area. So they can do a variety of different things. A periodontist is one that focuses on the gums. All right, so next I'm going to talk about a prosthodontist, and this is the restorative dentist. So this is the dentist that really focuses on having a nice smile and putting teeth where there may not be any teeth. So dentures, partial dentures, crowns, veneers, implants, things like that. They are focused on restoring the patient's dentition and helping them have a nice smile as well as comfort. So with these procedures, they usually see adult patients. It's very rare that they see a lot of kids and youth because they're usually not ready for these procedures. They can see some, but majority of their patients are adults. So that is something to keep in mind. But they are mainly concerned with restoring the smile and, like I said, focusing on kind of cosmetic as well as comfort for the patients and helping them have teeth to maybe chew on the back and things like that. So this is not a specialty, but it's more of a marketing strategy. So some dentists will classify themselves as a cosmetic dentist. So that is not an official specialty, but that is a way that some dentists market themselves, and that kind of showcases that they want to focus on a cosmetic smile and a more aesthetic appealing smile. So they also will do or be heavy doing procedures that are the veneers and the crowns, the bridges, the implants, things like that. So just as I mentioned before, a general dentist can do all of those things, but if someone wants to market themselves as a cosmetic dentist, that means that they like doing those procedures and they do a lot of those, or want to do a lot of those procedures that deals with the aesthetic smile. But a prosthodontist is the one that is the actual specialty that focuses on restoring the teeth. So the one specialty that does focus on the kids is the Pediodontist, which is the pediatric dentist. And so they are the ones that specialize in seeing the babies and the young patients and teenagers, things like that. So they focus on the youth, and they do the same procedures like a general dentist. So they will do the fillings, and they will do the crowns, they will do some pulpotomies, they will do some extractions, but it's just that they cater to a younger demographic patient pool. So these are the specialists. They also see special needs patients, so that's something also to consider. And so if a general dentist has a patient that is not compliant, they're screaming, kicking, acting up in the dental office, then they would then send that patient that has behavioral issues that they cannot tame to the pediatric dentist, and they specialize in that, and they have the resources and the skills to really treat the patients and to take care of those situations. Okay, so next we have the orthodontist. that is the specialty that I am pursuing. So this is pretty much braces. So if you're interested in impacting someone and giving them a nice straight smile, orthodontics is a specialty for you. So things to note with this specialty is that you usually do see and work with a lot of youth. So we don't see the babies, obviously they're too young. We only see a certain age range that will have either interceptive treatment or start their braces. But there also are patients that we see that are a lot of adults now, because a lot of adults don't necessarily want to have the traditional brackets, but because of clear aligners, which is like Invisalign and things, companies like that, that's more aesthetically pleasing to an adult that still wants to straighten their teeth. So we cater to youth. Mainly, majority of the patients will be youth, but we also are starting to see a lot more adult patients now. With ortho too, we also don't just mainly put braces on. We do interceptive treatment like I kind of mentioned before. So that is pretty much where a patient may be too young to actually have the traditional braces put on. But if there is an issue that they want to address, this interceptive treatment will help prevent the situation from getting worse and even help correct that problem that the patient feels like they have, such as if a patient is sucking their thumb, you don't necessarily have to put braces on at that age, but you can give an appliance called a tongue crib so that the patient, it helps break that habit. So they don't have to put the braces on, but this is still helping them break that habit before they get to the braces stage. So this is ortho. Also with ortho, to keep in mind is that you do develop a relationship with your patients, just like general dentists and other specialties that see their patients over time. But with ortho also, ortho treatment usually takes about 2 to 3 years, maybe more to complete, hopefully not more, but usually 2 to 3 years to complete. So you're seeing those patients very frequently throughout those 2 to 3 years. So you do develop a relationship with those patients. So it's good because you do have an opportunity to build good rapport with your patients and kind of see them grow throughout the years. So that is ortho braces. Okay, so the next specialist is an endodontist. So this is the root canal specialist. And for whatever reason, people are really fearful to get a root canal. I mean, you're numb just like other procedures that require drilling and possible discomfort. You get numb for this, so I don't know why so many people are scared to get a root canal. But anyway, the endodontist is the specialty that specializes in root canal therapy. So they see the patients that are maybe in severe pain where the decay is impacting the nerve at this point, so they remove the nerve from the tooth. Also, if a patient has a nerve that is dying and that area is infected, then they also would take out the nerve from that tooth and fill in that tooth with restorative material. So the endodontist specializes in this. One thing to take note from this specialty is that you don't see your patients for a long period of time. So you see a patient maybe once, twice, maybe 3 times for follow-up, and if they have other root canals, but you see this specialist because you're in pain or whatever the situation is, and then you kind of don't see them again. You then go back to your general dentist. So they are actually kind of the opposite of ortho as far as you seeing your patients frequently. They only see their patients a couple of times and they kind of never see them again. So if that's something that you're into, and if you really have a love for doing root canals and helping your patients get out of pain and really helping them prevent further spread of infection and things like that regarding the root canal therapy, this is a specialty for you. Okay, so you also have the oral maxillofacial surgeon, and this specialty really feels like they are the head honcho of the dentist, but honestly, they do a lot, and it requires a lot of training for them to get to this position. So these oral surgeons, common procedures that they do are like third molar extractions, regular extractions, they do implants, they work with impacted teeth, and they also do, they are treating patients that may have had facial injuries, fractures. They also do jaw surgery, so they can manipulate the jaw to move forward, back, up, down. I mean, they do a lot. So for this specialty though, you do have to take another test, I want to say. I think it's a medical exam actually, but you have to take another test in order to do this specialty. And also during their residency to be an oral surgeon, you are also on call very frequently. So you definitely have to have a passion for this, because this will take a lot of time and energy and commitment to get to that stage of, yes, you are an oral surgeon, but they do a lot and they're very knowledgeable, and they also work closely with other specialties because, as I mentioned before, if a general dentist or even another specialty does not feel comfortable doing a certain procedure, they are trained and skilled in those things. So they work closely with the orthodontist for maybe orthodontic surgery where you're manipulating the jaws. Also, if a patient needs to have the third molars taken out, as I mentioned before, the general dentist will refer to the oral surgeon if they don't feel comfortable doing it themselves. So the oral surgeon definitely does a lot, and they have been known to be a cocky specialty, but they definitely put in a lot of work. So that's that specialty. Other specialties that are not as common, or I'm not that familiar with them, but they're definitely out there, are you have pathology. So this is a specialty that kind of involves research and diagnosing diseases. So if you're doing a clinical exam or you see something in the radiographs, or if you see something clinically in the patient's mouth that is not within normal limits, then you would consult with a pathology specialist to help determine the diagnosis of what that thing is, and then hopefully also like the treatment for that. So pathology is a specialty in dentistry. Then you also have radiology, so they are specialists in interpreting the imaging and also helping to diagnose what those things could be. So you have radiology, you have public health. So this is a specialty that helps in preventing and controlling dental diseases and how it impacts the community, as opposed to like an individual patient, but more on a wider scale. So how it impacts the community. So public health is another specialty in dentistry. And then a new one that I really found out about this year or last year is anesthesiology. So just how you have anesthesiologists for the medical field, you also have those that specialize in dentistry. So they're the ones managing the pain for those that are undergoing procedures and undergoing surgeries that are dental surgeries and dental procedures. So you have the anesthesiology. One thing that I want to mention when it comes to these specialties is that in order to specialize, it definitely takes additional training. So you have the 4 years of dental school, and once you complete that, you are a general dentist. So again, you can do anything your heart desires, anything you feel comfortable with, you can do that. If you want to specialize, you have to do a residency program, and that's more training, more years. Usually it's about 2 to 3 years, but that just depends on whatever specialty you're interested in and what you want to do. So you have to do your research and see how long each program is and what specialty you're interested in. But I hope this gave a little bit of insight and helped someone as far as what the different specialties mean and what they entail. And if you guys have any other questions, feel free to contact me and I'll do my best to answer all the questions for you, okay? Have a great day and look out for my next video.